I'm going to start with the top and go down. I'm going to start with one of the most common problems that we deal with as orthopedic surgeons. That's neck pain. Degenerative disc disease is a problem that's very common to many people, particularly in North America. It's a vascular problem, and we're going to show you how you can avoid neck pain and prolong the time period that it takes to develop degenerative disc disease. Many people sitting at a desk get totally inadequate exercise for their necks. So what I'm going to show you is very simple to do. It will give you a range of motion for your neck, and then it will show you how to strengthen your neck so that you avoid the pain that begins in the superior trapezius muscle that inserts into the base of the skull. So here's how you do it. It's really quite simple. Just roll your head around like a ball on a chain. I usually do 10 repetitions going one direction and 10 in the other, taking it through a full range of motion. And you begin like this. Drop your head forward, roll it gently to the left, back, to the right, forward, back, left, to the right, forward, back, left, to the right, forward. You get the idea. I go 10 repetitions counterclockwise and then 10 repetitions clockwise. Again, forward, right, back, left, forward, right, back, left. You get the idea. 10 repetitions counterclockwise, 10 repetitions clockwise. That gives you a gentle range of motion to your zygoapophyseal joints and your superior trapezius muscle. Now we need to strengthen your superior trapezius muscle. Most people have totally inadequate trapezius muscles. Your trapezius muscle begins in your low back, goes out to your shoulders, comes in and inserts to the base of your skull on the back. And here's how you do the strengthening exercise. Interlock your fingers, put your hands behind the back of your head, push forward with your hands and backward with your head. Now in order to do it rhythmically, what I do is this. I do toe stands because I'm trying to be efficient with my time. I'm trying to get my exercise program in 30 minutes. So, pulling the hands forward, pushing the head backward, I begin toe exercises. 1, 2, 3, 4. You get the idea. I'm developing an isometric strengthening program for the back of my neck. Now, I do 25 of those. You can build up from whatever you're comfortable with to 25. And then move over to the right side of your head, push your hand to the left, and push your head to the right, and continue with the exercises. 1, 2, 3, 4, 5. And then move over to the left. 1, 2, 3, 4, 5. And then forward. I'm going to turn sideways so you can see what I'm doing. I put the palm of my hand against my forehead, my left hand on the back of my right elbow, and then I do the same thing. 1, 2, 3, 4, 5. I think it's worthwhile to vary your exercises, but strengthening your neck is vitally important. If you're having pain during the day when you're sitting at a computer or sitting at your desk, one of the things you must realize that you should be looking horizontal at the work that you're dealing with. So if you're reading a book, it's perfectly all right to pick up the book and get it so that it's more at eye level, so that you're not looking down at the book causing neck pain. Whenever you're muscles are tight, you momentarily cut off your circulation. And if you're staring down at a book for an extended period of time, you cut off the circulation to your superior trapezius muscle and produce an excessive amount of lactic acid, which then bathes the muscles of your neck and causes pain in the neck, and sometimes pain moving up to the base of the skull and over your head, which you may interpret as a headache. This is